Hello, good evening and welcome to our second session about fertility treatment at Institut Marquès. We have a very wide, a very big donation program here at IM, and anonymity and very short waiting lists for donors and technological excellence mean people will travel from all over the world to come and see us. A few months ago I was really pleased that about 70 people were able to follow my chat about egg donation, in which I explained briefly the main reasons why more and more women need egg donation, who our donors are, and how donation is organised at Institut Marquès. If you're interested in hearing this information again, then you can access the session via our website or indeed directly via YouTube. Today, however, I will focus on embryo donation because that we are doing actually more and more, and with very good results, which I'll go through. I will in my talk cover a little bit. I will compare and contrast egg donation and embryo donation, but mainly will try and emphasize the important aspects of embryo donation. So I will cover today what is the difference between embryo adoption and embryo donation, who seeks these particular embryos, what their success rates are, how we match the embryos with their recipients, how we prepare patients for embryo donation, and how we organize remote treatment at IM. As I've written below in the chat section, if you have any questions, please do send them and we will be able to go through them at the end. It doesn't matter whether they relate to egg donation or embryo donation or adoption. I will try and answer everything if we have time. So the first section is about, well, what is the difference between embryo adoption and embryo donation? Well, essentially, the difference between the two is a legal one. As you can imagine from the term, embryo donation are embryos that are donated to us. So a couple who have finished their reproductive project write on their consent forms that their surplus embryos are to be given to us. Embryo adoption occurs when embryos have been left with us for more than 5 years. And during those 5 years, we have tried to contact the owners of the embryo, and they have refused to get back into contact with us. And so Spanish law, after 5 years of regular contact and trying to make contact, Spanish law allows us to take those embryos and use them as we see fit. Now, in both cases, we vet the embryos. So they have to come from females who are under 35. They have to come from people who are healthy. They are not allowed to be carriers of HIV, hepatitis B, C, syphilis, and neither can have a fertility problem. So to give you an example, yesterday we transferred some embryos from embryo donation that had been given to us from a couple who had come to us for egg donation and using the husband's sperm. In their fresh cycle, the recipient couple had created twins, and the husband himself had 3 children from a previous relationship. So he had created 5 children in total. They had given us their surplus embryos. The donor was under 35, the female donor was under 35, and so we felt happy to accept those embryos into the bank and pass them on to another person. So with regard to the terms embryo adoption and embryo donation, we use them actually interchangeably, but you can see that they come from different sources. So who would want these embryos? Well, we have 2 main groups. We have the group of patients who are common to egg donation as well. We have the group of patients who have ovarian failure, premature aging of the ovaries, couples who have very severe male factor problems, couples with a long history of infertility of unknown origin, and also couples who have recurrent miscarriages, again of unknown origin. In most of these cases, the patients could choose alternatives to donor embryos. They could go for egg donation, or they could use pre-implantation genetic diagnosis to try and work out where the problem lies for them. But donor embryos offer a cheaper and an easier option that many people find very appealing. There's a second group of patients who come to us for more social reasons. We have a lot of single women who come, a lot of female couples who choose to go that route rather than using their own eggs or donor eggs, and of course donor sperm. We also have patients who are thinking of or waiting for formal adoption, and they think that this is actually a quicker option, often is a quicker option, and sometimes a cheaper option as well. So to date, we've had patients from 28 countries come to seek these embryos since we started the program in 2004, and over 600 children have been born to the program. What are the success rates with donor embryos? As you will understand, the abandoned embryos and the donated embryos enter our bank whilst frozen. So this explains their success rate, which is currently 46.9% for the last 6 months, the most recent 6 months of 2012. This is in fact a very high result for frozen embryos, and we can explain this high result in two ways. First of all, the embryos come from a batch, as it were, that have often produced pregnancies and live births with the fresh embryo transfer. And secondly, we now vitrify all our frozen embryos, well, all our extra embryos, and this process of cryopreservation gives a much better survival rate once the embryos have been defrosted. So how do we match embryos, donor embryos, with the recipients? So in fresh egg donation, we match the physical characteristics and blood groups of the donor to that of the recipient. But in embryo donation, there is no matching, no formal matching at all. The only thing that we have to guarantee is that there is racial compatibility. So you can't have, for example, a black couple having a white baby, or a white woman having a black child. Even if they want it, that's not possible. We ensure that the racial compatibility is maintained, but matching of specific physical characteristics and blood groups is not part of this particular treatment option. People worry that because there is no direct matching, particularly of blood groups, that the embryos are going to be rejected. But this is not the case. You don't need blood group matching to have success. It doesn't mean the embryos are going to be rejected if the blood groups are not the same. It's totally unrelated. We do it in egg donation because people like it, but it's not necessary from a medical perspective. So how do you prepare for donor embryos? Well, it's actually very easy. If you still have a menstrual cycle, then all you have to do is start the treatment with the first menstrual cycle that suits you. And the treatment involves starting estrogen patches, which you would begin with your first day of the period. You change the patches every 4th day, have a scan in your own country to measure the lining thickness, the endometrial lining thickness, and you send us the result. We can start in this way because the embryos are frozen, so there is no waiting list. We just have to wait for your period to come. Once you've sent us the scan result, we review it, and then we organize the embryo transfer within the 2 to 3 weeks that follow. according to your availability, according to the system, to the logistics of the system here. And so you come over, and prior to embryo transfer, you also start some progesterone pessaries, and these you apply once every 8 hours. So you come for transfer, the patch is on, the pessaries inside the vagina, you have the embryo transfer, and then continue with that medication until the pregnancy test. And if that is positive, you increase the doses of both medications and keep going for another 10 weeks. So in that respect, the treatment is very, very similar to egg donation. The main difference being that with egg donation, you have to synchronize with a specific donor. So we use the pill at the beginning usually to do that synchronization. But with embryo donation, that synchronization is not necessary. If you are a person who doesn't have periods anymore, then often what we would do would be induce them. One way is by starting the pill for a couple of months, bring the periods back, and then start the same treatment with patches and take it from there. How do we organize treatment at a distance? People worry that they're very far away, so how can we organize it well and make people feel supported? Well, we have a 3-pronged team for each patient. So for each patient who contacts us, she will have allocated to her a doctor, a patient assistant, and a medical assistant. So what happens is that you contact us, you or your doctor. Now, increasingly, we're getting patients being referred directly by their doctors in their own country. You contact us, and the PA, the patient assistant, will organize a first visit with you at your convenience and with the doctor who is free at that time. And we normally organize that first visit here in Barcelona. If you want more information prior to that, we can organize 15-minute sort of show you around the building kind of things, show you the people, that kind of thing. We can organize by Skype or telephone, but the first visit usually does occur here in Barcelona with the doctor. In that first visit, we go through your medical history, fertility history, surgical history, anything that we think is relevant to the treatment here. And we do a pelvic scan, we do a catheter test, we go through the medication, we give you the medication, and explain everything with you. So that is what the first visit involves. There are some people who live very far away or who find it inconvenient to come to Barcelona for that first visit. So for those patients, we can do the whole first visit by Skype or by telephone. And increasingly, for example, with patients from Australia or whatever, we are doing that. And in that case, we go through exactly the same thing, going through their medical history, surgical history, fertility history. But of course, we can't do any tests. So in that case, we ask the patient to send us results of tests that have been done by their gynecologist in their country. We then review the information and process everything here and keep the contact going via email. Once you've had the first visit, then we set things up for the treatment, when it can happen, and so forth. And at that point in the treatment, the medical assistants are very important. They act as a kind of bridge between the doctors and the patient and transmit. Let's say you send a scan report. It goes to the medical assistant then goes and sees the doctor, find out what the doctor thinks, and the doctor will then give their opinion, and the medical assistant will get back to the patient. The medical assistant will also send lots of instructions for transfer, requests for ultrasounds. They are the main person. Once the person is actually organizing their treatment, they will be the main point of communication for the patient. Patients often worry that there might be a language barrier, but in fact there rarely is. All of the PAs and the MAs speak very good English, so that's the main first language. But in fact, we can cover almost all of the European languages and Russian. So if you have or want to speak in your own language and it isn't English, we can usually accommodate that. And the doctors all speak English, but a lot of them speak Italian, French, German, and if that's not one of the languages that you speak, then we can often find a translator who will work as the intermediary all the way through. Okay. So, in conclusion, embryo donation is an economical treatment option. It offers very good success rates, and we use embryos that are racially matched to the recipients. And by accepting this treatment, you allow new life to be created when really the embryos could very easily have remained frozen and unused. So that's the end of my talk at the moment, but I can see that there are quite a lot of questions coming in, mainly related to egg donation, but maybe some about embryo adoption as well. So I'll go through those now. We've got one patient from Sweden who is asking about our offices. We have several offices. We have an office in London, we have an office in Dublin. These offices are purely administrative though. We don't have any doctors there, we're not allowed to have doctors there. But the administrative offices can help sort of clarify exactly what it's like to have treatment with us. They can organise Skype visits. If you don't have Skype at home, you can have Skype from the office. So those offices are for administration only. Okay. Someone asked whether the prices differ when you come from different countries, and no, they don't. The prices are the same whether you come from England, Sweden, Australia. It doesn't make any difference. The prices are the same according to the treatment you choose. This person in Sweden is asking about whether she can use her sperm with a donor egg. Yes, absolutely. That can be used. That's the egg donation treatment. That's what a lot of patients do. It's very successful. Our success rates at the moment are 73% per cycle, but it's much more expensive. So that's where embryo donation can be acceptable. But if you're in a couple and you want to use your husband's sperm, then yes, of course, by all means, donor egg treatment is our main treatment here at IM, so we're happy to do that. Another person asks whether there'll be a recording of this presentation available online. Yes, usually within about a week. Yes, we'll be able to it should be online quite soon. If you need another copy, we can send it to you. Is that what you're telling me? Oh, we can send the link. Sorry, we can send the link. So that should be fine. There's someone who asks about whether we do ICSI. If we're doing egg donation, yes. If your husband provides the sperm, we would then do ICSI for all mature embryos, mature eggs collected. Technically, it's not possible to do ICSI of immature eggs collected. So on that occasion, we might do just standard conventional fertilization, but ICSI is done and included in the price of egg donation because we assume it will occur. It will occur for all the mature eggs collected from the donor. Someone is asking what is the cost of, you're highlighting. Oh, so if you do embryo donation, what do you find out about the biological parents? You find out the blood groups of both, the age of the female donor, and usually that is it. We're not obliged to release any more information, but many people do request more so we can go into the system and get that out. But essentially it is just blood groups and age of the female donor. Yeah? The cost of embryo donation is currently just under 3,600 euros per transfer. So related to egg donation, which is currently about 10,000 euros, that's a very interesting price. There's also a refunding scheme for embryo donation, which costs 11,000 euros. For that, you'd have 3 attempts at embryo donation, and if unsuccessful, we would return 70% of the money. So that exists as well. Can we send you prices for donor eggs with your own sperm? Yes, of course we can send you that. That can be organised over the next few days. That shouldn't be a problem. After the first treatment, do we have to go to Barcelona very often? Well, if you come to Barcelona for the first visit, then your return, whenever it happens, should be for the treatment. It's rare to come in between. And if you're successful, then hopefully you won't have to come back again. Is there an ideal BMI for the female egg donor? Ideally, it would be around 25. There's been some research to indicate that if your BMI is under about 19, there's a kind of U-shaped curve in terms of a female's fertility. So if you're about 25, it's optimal, and if you're very underweight or very overweight, the fertility goes down. So that tends to be around 25. That's what we're looking for in the donors. What is the fully inclusive charge for fresh egg donation and all the medication? Well, the medication for the donor is included in the price that I mentioned earlier, so 10,000 euros. It also includes a certain amount of medication for the recipient. Enough to take you to the pregnancy test. If it's positive, then you would have to source more medication and pay for it in your own country. Okay. How often, how long does the process take, and how long? So if you're coming to Spain for the first visit, that takes a few hours, and you can come in the morning and go home in the evening. So it's a very short stay. For the transfer, we usually advise coming the night before embryo transfer and staying the night of the embryo transfer. So usually a 2-night stay. Many people make it a bit longer for their own convenience, but it's not necessary. Usually just a 2-night stay. What is the cost of embryo donation, embryo adoption? Embryo adoption, as I mentioned earlier, is currently about 3,600 euros. Embryo adoption. Egg donation is currently 10,000 euros. The difference being that when you have egg donation, the donor has been stimulated solely for you, and the embryos you're having transferred are fresh and offer you a very high success rate, currently about 73%. With embryo donation, the embryos have already been created, they are frozen, they are being given to you with racial matching only, and are therefore much cheaper. Okay, hope it's clear. Do we have an embryoscope in our lab? We do. We are using it increasingly. It's a very useful technique. It's mainly associated with egg donation, though. It's not something we use so much for embryo donation. Is it possible to have embryo transfer and fly home the same day? It is. It's not something we necessarily recommend. The theory is that if you're flying the same day, it can sort of shake you around. The embryos have been put back that day, and maybe they won't like it. We don't have a lot of evidence to say that that's true, but that's the theory. So we tend to advise people to fly back the next day. But if you want to go back the same day, a lot of patients do, including transatlantic flights or going across what are they called? Very big flights, very long flights. What is the embryoscope? An embryoscope is essentially an incubator, a very special incubator. It offers, what we do is we create, on the day of the donor egg collection, this is with use in egg donation, with donor egg collection we fertilize with usually the husband's sperm and put them into the embryoscope. And they stay there for 3 days in a very, very constant environment, constant in terms of temperature, pH and light. This seems to be very good for them, the fact that we don't touch them and just look at them by means of a camera. The camera takes a photograph of them every 20 minutes, and this is very useful for the embryologists because they see the embryo evolving almost real time. But also it's it's a nice thing for the patients because they can actually, if you've got one of those smartphones, you can actually see your embryos evolving. You can download a program, an app or whatever it is, and you can see your own embryos evolving. So it works very well. It gives additional information to the embryologist, but it is usually just available for egg donation. Okay. Do we have an age limit for those who want embryo adoption? Yes, same as for egg donation actually, it's about 50, around the age of 50. Due to ovarian cancer, I don't have ovaries. Does this limit the chance of carrying a child? We would need to review, that's a very specific case. In cancers, if you've had cancer, we can sometimes do treatment for you, but your case needs to be reviewed by a committee that we refer to. It's a committee that sits and reviews lots of different clinics, patients in different clinics, and we would have to have a lot of information about the treatment you've undergone, the actual stage of the cancer you had prior to the curative treatment, the risks involved. We use estrogens in your treatment, so if you had an estrogen sensitive cancer, often it's not possible to treat you. Things like that, but it's a very specific case. So if you're interested in treatment and you want, we can in theory do it if you still have a uterus, but we need to review your case in particular. Okay. If a woman has a history of miscarriage with her own eggs, is she still a high risk with egg donation or embryo adoption? It depends. It depends on her age. Let's say, for example, you're 40, 42, 45, and you've had lots of miscarriages, then we would think, based on tests as well, that the miscarriages are probably related to your egg quality, and then the chances of miscarrying with egg donation or embryo adoption would be much, much lower. If, however, you are in your early 30s and you're miscarrying for a different reason, a reason related either maybe to your husband's sperm or to your to hematological problems or some other factor that we don't yet know about, then that may still affect your chances of success with egg donation. With embryo adoption, in theory, you'd have no problem at all unless it's related to a hematological problem of yours. So every case is different, but in general, with a history of miscarriage, your chances are better with egg donation or embryo donation. Yeah? I'm being told that it's time we have to stop now. If you have more questions, please do send them, and either I or one of my colleagues will try to get back to you with answers to your particular case, and we'll try and help you as soon as we can. Thank you very much for your time. It's been a pleasure.